Apalutamide is a novel oral anti-androgen that is under consideration by the FDA for treatment of M0 CRPC. It was originally called, or the chemical name is ARN 509, which would be its research name, and it's under development by Janssen Pharmaceuticals. It has been looked at in phase 2 trials, and they were very promising. Matthew Smith and colleagues, Matt is a well-known medical oncologist in Boston, was the principal investigator on the phase 2 trial of apalutamide, which gave a strong signal of its safety and effectiveness. The drug was well tolerated. Less than 15% of patients in the phase 2 trial had to go off the drug for side effects. So more than 85% of patients stayed on the drug. The PSA response in the phase 2 trial was almost 90%, meaning that more than 90% of patients had a greater than 50% PSA response, and a significant number of men, almost half of those men, were able to stay on apalutamide for at least 2 years in the setting of M0 castrate-resistant prostate cancer. And that has led to a subsequent phase 3 randomized controlled trial that is now essentially almost enrolled and has been submitted to the FDA. The phase 3 clinical trial for apalutamide is called the Spartan Trial. It was initiated in 2013, and recently Janssen had a press release saying that the trial had met its primary endpoint of delaying progression to metastatic disease. So again, these gentlemen were M0 castrate-resistant prostate cancer. The primary endpoint of the phase 3 trial was progression to metastatic disease, and the press release states that the trial was positive, meaning that the drug apalutamide had a statistically significant benefit compared to placebo in delaying the time to metastatic disease. And because of the trial being positive, they have submitted an application to the FDA for consideration of apalutamide receiving FDA approval to specifically treat men with M0 CRPC.
The Spartan study looks at non-metastatic castration-resistant prostate cancer. So that means typically a rising PSA without any tumors seen on a bone scan or a CAT scan. And part of the reason we have this space in prostate cancer is because our imaging studies they can't find tumors that are smaller than a pea. So we have this space where we can't see anything on our typical scans. The patient might have grains of sand here and there, but there's something in there. No other organ makes PSA. So the Spartan study looked at these guys who had a PSA doubling time of shorter than 10 months and randomized them to placebo versus the apalutamide, and the primary endpoint was metastasis-free survival. So these patients did not have PSAs checked. They had imaging studies checked, and all the imaging studies were reviewed by a central reviewer to look for new metastatic disease, and that time was measured.
The Rathkoff study, which was published in the Journal of Clinical Oncology in 2013, demonstrated a high degree of clinical activity of apalutamide, which was previously known as ARN 509. In that study, we looked at a variety of doses and found it to be generally safe for oral administration on a long-term basis. We also found that a high number of patients, about 50% of all patients on the study, experienced a 50% decline in their PSA or greater. However, some of those patients had abiraterone-resistant disease and therefore would not be expected to have a high likelihood of responding to apalutamide. In the non-metastatic setting in which this has been explored in a phase 2 study, the number of patients who experienced a PSA decline of 50% or greater was much higher. It was, I think, well over 80%. So in summary, apalutamide is a well-tolerated, orally available, next-generation androgen receptor antagonist.